Hi there, my name is Alexandra Madsen. I'm in the English 250 course with Ms. Nelson. I did my portfolio project on why nurses quit their jobs. Now, I found this very interesting because I'm currently experiencing this at my workplace. A lot of my nurses are very unhappy with the way that things are run, and I kind of asked them at first, why are you quitting? Like what's going on? And a lot of the responses that I got was that they were not feeling challenged and that they did not get along with the management. So that's how I decided to come across my research topic. From there, I looked on our virtual library and I found many different sources that did a couple of case studies on why nurses quit their job. Now, it ranged from new nurses to old nurses on why they were quitting. A lot of people quit when they were younger because of the bullying of nurses. Now, I work at a hospital and I see this happen to many of the younger nurses that I do work with, so I found that very relatable and easy to talk about. The not getting along with the management is what I had witnessed at my job and why one of the nurses that I was close with quit. So I was also very familiar with that. So fortunately, that was able to be one of my strengths for this paper, that I had personal experience that I could relate to. Now, I also found it interesting because I was possibly thinking about sending this to my manager because it is actually useful information that we can use and implement in our workplace. Some things that I would do differently about this paper that I would probably leave a little bit more time to research. Now, I did quite a bit of research on our virtual library, but I would probably like to step out of our virtual library and go to my neighborhood public library and take a look and see what they have research-wise. I would also probably keep an APA handbook next to me while I was doing it. I'm not 100% familiar with the APA formatting, so this would probably be a really good thing for me. Some of the course outcomes that were met was obviously my ability to write professionally. Now, throughout this 7.5 week course, I was able to identify the cultural barriers, language barriers, and my personal professional barriers. And the way that I have overcome these barriers is having someone proofread my work. That was a big thing for me because usually I don't like people to proofread my work for me. I usually am confident in what I write, but I found it helpful for my classmates to give me different opinions and different insights about my work. So, overall, I would say that my professional communication has become a lot better through this course. So, I would like to choose enthusiasm as my first uh, discussion topic. Now, enthusiasm is really important in nursing. Now, many people wouldn't think that it would be important in nursing, but it truly is. When you are dealing with patients, clients, doctors, family members, and so on, you have to be enthusiastic about what you're doing. You have to let them know that, hey, I'm here, I love my job, and I'm here to help you. Now, when people are down and in the dumps about possibly, you say, a bad diagnosis, you being enthusiastic about if they have a chance of getting better or something like that may uplift their spirits and have them have a better day. Enthusiasm kind of coincides with the attitude aspect. With an enthusiastic persona, you can also have a great attitude. Now, if you come into work with a negative attitude and you're down in the dumps over something personal that the patient has no effect on, it'll make them feel bad about themselves. And the nursing community now is a lot about patient care and patient satisfaction along with the family satisfaction. Now, you won't be able to reach this goal if you have a very negative attitude. Overall, this professional writing course has helped me a lot. I have learned to be more conscious about my culture aspects and the way I write to my coworkers and other professional people.